Mediators at peace talks in Switzerland focused on Sudan's civil war are trying to open up 3 humanitarian routes that could allow relief into more than 20 million people currently cut off from food and medical aid. 16 months of battling in Sudan have sparked several crises, and health workers have warned just this week that dozens of people have died as the spectre of cholera becomes increasingly evident.
With limited resources, doctors do their best to treat patients at this hospital in the eastern Sudanese state of Cholera, where several people have died from cholera. After weeks of heavy rain, the war-torn country's health ministry has declared an epidemic of the disease, saying it's the result of weather conditions and contaminated drinking water.
The problem in the area is that the vast majority of residents rely on river water as a source of drinking water, whereas it is polluted and needs treatment, and this requires volunteers to treat the water.
According to the WHO, the conflict, which broke out between the Sudanese army and paramilitary rapid support forces in April last year, has exacerbated infections including cholera. The fighting has also left more than half of the country's population facing food insecurity. Sudan's government has agreed to send a delegation to Cairo for talks about implementing a previous humanitarian deal agreed by the warring parties in May last year. Those on the ground say such a deal is more crucial than ever.
There have been kids in the therapeutic feeding, on the ambulatory therapeutic feeding center where we receive children with malnutrition who were above 1 year old, who looked like they are 4 or 5 months old. They can't walk. A lot of children, once they reach a stage of malnutrition, they stop eating even if some food is available. So it's a self-compounding problem.
On Thursday, the Sudanese government agreed to reopen the outbreak crossing on the border with Chad, a vital route for humanitarian aid to enter the country. The UN's World Food Programme has said it is ready to start delivering nearly 6,000 tonnes of food through the crossing.